Hi, everybody. I'm Brian, and this is AAMI News and Conversation. We're here on day 3 of Sterilization Standards Week, and I'm here today with two exciting guests, Sopek and Amy. But before we get started, why don't you just introduce yourselves and tell me your roles within the industry?
Okay. My name's Amy Karen. I work at WL Gore and Associates. I am currently the AAMI co-chair for TC 198 Working Group 8 with SOPEC. And I'm also the ISO convener for TC 198 Working Group 8. So that's who I am.
That's who you are. And you know what? We were joking about this a little bit beforehand, but when we say Amy, we're usually talking about Amy, but maybe we're also talking about AAMI. But I will try to be clear about that distinction. And Sopek, who are you?
Yeah, my name is Sopek Strun. I work for QTS. We're a contract manufacturer. And I'm also co-chair along with Amy for Working Group 8, Microbiological Methods.
All right. And so my Working Group 8 has been meeting this week to work on a really exciting new document. It's always fun to hear a new document as opposed to a revision or an overhaul. And in this case, this new document is a technical information report. So Sopek, what is it addressing?
So, the AAMI TIR 106, the title is Microbiological Methods, Understanding and Use of Product Bioburden Data. So it covers all aspects of how you would perform bioburden testing and how to use that data, how to interpret that data. So it's meant to be used in conjunction with one of the international standards, ISO 11737-1. So this is a guidance document that is supposed to be helpful for using it in conjunction with the other document.
And I'm sure a lot of our viewers are very impressed just now that Sopek remembered that entire alphanumeric stream of letters and numbers.
We get used to it.
Amy, before we dive into the kind of purpose of the document, I wanted to start with something very easy, which is just, can you elevator pitch, what is bioburden?
So bioburden is the detection and enumeration of all viable organisms on or in a device. Our job is to sterilize devices, and so we need to know how many and what we're trying to sterilize. So that is what bioburden is just the detection of all viable microorganisms.
And do you start with assessing bioburden? Say if you're testing the cleaning of a device, you would get that device soiled, then you would do the test?
That is correct. Most often, though, and especially for the scope of this document, we're actually looking at the bioburden that's contributed through the manufacturing process.
Oh.
So the natural bioburden.
The natural
right,
bioburden.
interesting.
We use that term a lot, natural
bioburden. Yep. Because, even in clean rooms, when you make a device, it has viable microorganisms on them. And so we try to control the number and the types, but we still need to know what they are. And that's why we do bioburden testing.
That's fascinating. So you're working on a very, it is microbiology, but you're working at a very small scale then, right? These are, as you said, it's still a clean room. Mm-hmm. So you're looking at differences between very, very small numbers. And I guess, when is it over the line, when it isn't? So what need is this addressing, right? Did the industry say, hey, we do this right now, but we would like some guidance, a little bit more help on one way thing or another? Sopek, you want to help me with that?
Yeah, so again, it's meant to be used in conjunction with the actual bioburden standard. Mm-hmm. The need came about, a lot of it was just related to a lot of companies would have issues with just knowing how to interpret the data, or they run into issues with notified bodies or regulators in having some of these conversations about their data, especially when you're talking about validating processes. Sometimes there can be sources of contention with how to do the math related to determining your counts. And so this document, it covers all sorts of these aspects, mm-hmm. From doing the testing to well, within the testing, it's also doing the microbiological methods and the methods for determining recovery efficiency. So that's related to the test method suitability or test method validation, depending on what you want to call it. It's really to fill this kind of a lot of people just don't know how to interpret or use the data sometimes.
Right.
Yeah. I think the other part of it is the bioburden standard is for all sterilization modalities. And the criticality of the bioburden data is different between the modalities. Some sterilization methods are bioburden based. And so bioburden is incredibly critical. You need to have it as accurate and estimated as best you can. The overkill methods, bioburden is really for monitoring. It's like you need to know what it is and that it's a consistent and a controlled level. So
and that's one of the things when I was saying, sometimes it can be contentious.
Yes. And so this document's trying to kind of separate those two things, or not separate them, but understand the criticality of the data and when it's necessary to do extra work or be more diligent on that gathering of the data. But as Sofek mentioned too, it's not only about the criticality of the data; it's understanding what you're reading. So I'm very proud of this document. I think it's going to be great. It is one of the few documents that has a lot of guidance also for labs on data interpretation. For instance, if they're not in accountable range, what do you do for an estimate? Those kind of things. So
yeah,
it's
really to try to align what industry is doing so that things are consistent.
That is correct. Yeah.
Right. And, when we talk about data and data interpretation, consistency is very important, so that if you're looking at research as conducted in a lab versus research conducted in an industry, you can still have collaborations, you can still have mutual understanding, which is, I love to see that when we talk about TIRs, because, that's really what they're set out to do, is to provide clarity. Absolutely. So that's exciting. Sopek, you had mentioned to me an interesting scenario where this document may apply, which is when something goes wrong with a process, the document might be there to help kind of figure out what went wrong. Can you tell me a little bit more about that?
Right. So it's not uncommon that you perform bioburden testing. So let's say you've completed all your validations. You still have to perform bioburden monitoring to make sure your process remains effective, because if your bioburden data, if it goes out of whack, you have really high counts randomly, that could reduce the effectiveness of your sterilization process, especially if you're using a bioburden-based method. So that's why it's important, we have to perform routine monitoring, whether that's monthly, quarterly, yearly, depending on the criticality of your process and even your device. And so when you perform that routine monitoring, it's not uncommon. Every now and then you might see really high counts. It could be really high counts on all the samples that you test, or it could be a really high count on maybe just one of the samples. And so when that happens, you have to investigate it. You have to look at, well, is this a true result? Did the lab screw up? Was there something wrong in the manufacturing process? Was a critical process skipped? If, let's say, your manufacturing process involves cleaning, did they forget to clean it?
Right.
Or it could even be, was there a change in the process that caused bioburden to become higher? It could be any number of things. And so doing these investigations can be really difficult if you don't know where to start. So within this document, we have a section that's dedicated to, well, here are the things that...
This is what you should be thinking about.
Yes.
When this situation arises. No, that's great. Amy, you were mentioning that, you're very excited about this document. It's coming together quickly. Who is at the table right now? What kind of stakeholders are helping make sure that the data and the suggestions within this document are I guess, rigorous, scientifically rigorous?
Good question. We had an initial task group that helped us, which was comprised of a bunch of experts from Working Group 8 and previous co-chairs to the microbiological methods. Sopek and I were also in that task group. So a lot of very, well-versed people in bioburden testing from both laboratories as well as industry that helped us. And I think the lab piece is an important piece of this too, because they're often the ones that are distributing the data and helping their customers to understand. So it was a task group of about 8-10 of us, something like that.
Around there, yeah.
And then the final review of the document, of course, was done by the entire working group. and we will say that it did go through quite a few iterations of committee drafts, as well as quite a few comments every iteration, so that we were really working, trying to get it to be a valuable document that made sense. I think some of the first struggles we had were the flow of the document, right? Trying to make sure we covered a lot of territory in it, including...
It's a brand new document.
And it's a brand new document, yeah. We had the criticality of the data, and then we had these, other interpretation of data and the lab pieces and such. So it was pretty challenging. But the answer to your question is we had a task group of very highly qualified people from labs as well as industry manufacturers. And then we had the entire working group do the technical review.
Oh, that's fantastic. I'm looking forward to seeing this document, have its first impact. What's the next step after publication? What comes next for your group?
The next step after publication, hopefully this TIR actually will stand on its own.
I see. And then would that mean that the TIR may influence that revision, or?
That is correct.
Oh, interesting.
Correct.
Okay,
Yeah.
so it's not the other way around. If the one document changes, the TIR might need to update as well.
It is possible,
Okay.
but again, the intent of the TIR was more to understand the output of that standard, and so what we are hoping is that the TIR can influence that the output's clearer in the standard.
So it'll help with the clarity if and when a future revision occurs.
That is correct.
That's exciting.
Okay.
Well, thank you so much for explaining this all to me, because clarity is what it's all about. This has been fun, and I'm looking forward to the rest of the week.
Me too.
Yeah, me too. Thank you.
It's a great group.